Welcome to our Zoom meeting. Today we will discuss different topics, but I'll invite any of the new fellows to raise their hands and see if they can introduce themselves, or maybe if they want to ask any questions. In the meantime, I'm gonna just go over some of the basics for research, and hopefully we can achieve some of the goal of this program. So Sitana, Dr. Sitana, please go ahead and introduce yourself. And if you have any questions, welcome to the program.
Hello, everyone. My name is Sittana Nuruddin Omar Muhammad. I graduated from University of Khartoum Faculty of Medicine in 2022. Nice to meet you all, and it's my honor to be here in this fellowship. Until now, I didn't start any project, so I'm looking forward to start with you all. Thank you.
Thank you and welcome, Dr. Sitana.
Thank you, Dr.
You're welcome.
Okay.
Anyone else or any questions? So go ahead, Dr. Safia.
Hello, everyone. Is my voice clear? My name is Safia Jahfer Yassin Ahmed. I am a graduate from University of Khartoum, Faculty of Medicine, 2022. Also, I am very happy to be here and thank you for this opportunity. I look forward for the project that we're going to do. And my question is, where do we start? Where do we begin in this program? And thank you for having me.
Welcome, Dr. Safia, and we will guide you. All the new fellows, welcome to the program. So basically, this program depends on teamwork. So you will be approached by a team leader, you will be in a team, and then you can connect with your team members and see what you want to learn and how we can achieve that together. At the same time, you can join an ongoing project, research project, or if you have an idea, you can create a new research project and create a team. And then we will have you, either yourself or some of the members in that team, to lead the project, and either we show you how, or if you have an idea, you can go ahead with the steps. Usually we divide the task between the team members, so everyone will have a part in the project, and hopefully we will finish the project and it will become a product where you can either present it as a poster in a conference, or perhaps you can send it to a journal and be published as a paper. Thank you. Anyone else, any new fellow in the program?
Hello, Dr. Nadir. I'm Iram Reza. I'm an international graduate from Pakistan, and I graduated in the year 22. And thank you so much for giving me this opportunity to be part of your program.
Welcome, Dr. Iram. And if you have questions as well, we will be happy to answer any questions. But the idea is to work together so that we can achieve your goal. Thank you.
Okay. Thank you, Dr. Nadir.
Anyone else, any of the new fellows? So I'm gonna just briefly talk about the steps for this program, and hopefully all will be on the same page, and hopefully we can complete some of the project together. As you join this program, you can use the app where you can find more of the resources that we use. Some of them are old meetings that we had, and they are recorded. Some of them are video or some other type of resources like PowerPoint presentation or slides that already done by the previous fellows, or we obtain it from other resources like organizations in the US. So I'm gonna go step by step with the app, and then we can see if you have any questions. Let me know. So I'm gonna share the screen here. So when you start the app, you will go to the first section here. Usually it's an announcement or something that we want you to know about. For example, there are some new residency programs in Texas. If you already have your steps ready and you have a visa, or if you have a citizenship, then you can apply to some of these programs. For example, we have some other program like Cleveland Clinic for those who are interested in either internal medicine or family medicine. They have a course, review course that will happen, I think, in July. And for fellows here in the program, they can apply to do that review course, and it costs $100 for a fellow in our program. And some of the fellows in the past, they attended that in the past 2 years. They found it very useful. They cover most of the important topics and cases they see in the hospital in the US. So we provide you with some updates here. Sometimes we have grant rounds, so you can also attend. Some of these courses or grant rounds are in person, some are virtual, so you can join via Zoom, for example. And there are other courses that you can join or you can learn from. We worked on mobile applications in the past, and if you want to know how, nowadays with the AI, it's easier to build up a mobile application. This is some example if you want to look at the steps here. And we will go over one of the development in a few minutes, basically how to create your own, but we want you to create something in a group, and hopefully this will help your patients. We have the meetings. In the previous meeting, you can look at our recordings. If you go here, for example, last week, and it will have the recording in YouTube video. These are the agenda for that week and who presented what topic and so on. You can go to the previous week and so on. For those who are interested in presenting or participating, volunteering, developing their presentation skills, or just to share with us their knowledge or learn something and try to present it in our meetings, we'll have next week, for example, and the week after, and so on, will be listed. So next week, one of the topic will be about gait impairment. Usually we have the meeting, the team color, and the team leader will organize the topics and the speakers. So if anyone interested, they can approach the blue team leader, and they can update their names here in the agenda so that we know who will be presenting what topic and so on. So if you're available in 2 weeks, you can go here and you can approach Dr. Omar, for example, and say, I'm interested in participating in presenting healthy aging topic. Some of the topics, if you scroll down, you will find the topic here. It's as a teaching sliding files. These files are presented by the American Geriatric Society. We focus on geriatric, but some of the topics can be applied to other disciplines like neurology or psych or family medicine, for example. So you will approach the team leader, tell them that I'm interested in presenting this topic on this day, and we would like to have some of you present either one presenter per topic or more. We appreciate if more than one fellow presented a topic, and that would be great as far as teamwork. So you will, if there are 2 fellows interested in presenting the first topic, the first fellow will present the first part, and then the second fellow will complete the second part as well. So this is how we organize the meetings for the next few weeks and so on. So you will have some idea of what topic we will discuss. If you are not presenting the topics that are listed, we appreciate if you go over some of the slides or the resources available, or if you want to look up the topic, you read about the topic by yourself, so that when we present the topic, you will be up to date, as well as you can contribute through the discussion after the topic is presented. For example, you can update us with what's new, what's the guidelines, and so on. Some of these slides are a little bit older, so there are few new guidelines that are created in the meantime. So we appreciate if someone can update us with what's going on lately in medicine. After that, you can go down and we have, as mentioned, we have some videos that we collect and make available for you about certain things that we want you to maybe improve or learn. For example, statistics, we have some of the videos available. If you are approaching the interviews time, for example, in August or September, you can look at these videos. Some of the tips are here, are made by some of the fellows in this program, and some were available from other programs similar to our program or different. Some of the topics presented about residency, what you expect, and so on. If you want to know about Excel, for example, or other PowerPoint presentation, for example, we have some videos about that. And at the end, we have some neurology grand rounds that happen on Fridays, usually in the morning, 7:30 to 9, and they present a case usually after the topic. And if you want to join, if you are interested in neurology, for example, we have internal medicine grand rounds every 2 weeks here in Lansing, so you can join that as well virtually. Here are some of the fellows that graduated from our program and joined either residency and are there, or graduate from the residency program there, or fellowship. So some of the fellows who completed 1 year at least here, they joined some of the either family geriatric fellowship, nephrology fellowship, or infectious disease fellowship, and they did 1 year or maybe 2, and then they can go back to do residency. It will be sometime easier for them to join the residency. So this is about the basics of the program. If you go down, we have some of the people who match, like this year, 2025, and if you scroll down, you can see fellows who match, I think, 2024 as well. So you can find them also here somewhere in the menu. We grouped you as far as your interest. For example, if you are a dental graduate, you will find some of the dental group here. If you are interested in some specific specialty, neurology, for example, you can join or discuss with these fellows in internal medicine as well. As far as teams, we divide you into teams depending on the color of the team, and each team, they will have a team leader. So if you want to reach some of the team leaders, you will find their information somewhere here. So for example, if you want to reach out to Dr. Omar Gary, you just ask if he is somewhere here and you will find his information. You can contact him via whatever WhatsApp, call, text, or email. And then you can ask the question, or if you want to have an idea, for example, you want to volunteer for the day when his team will be presenting. Some of these leaders were in our program, so they graduated. So you might not have a return call because they are busy with their residency, for example. So you can go to the next team leader in that group or team. So we have some of the seniors available, and you can approach them. Other groups, you can see who in your area. For example, we have a couple of fellows in Canada, for example. If you are in Canada and you'd like to work on a project together, maybe you can approach some of them and you can work on the same time zone or similar. It's not like a big of time difference, for example. And if there is a conference, for example, in Canada, and you are in Egypt, you want to participate with a project that you need someone to present, maybe you can select some of these fellows to be in your team so that one of them will be available to go in person, for example. And this is what we did in the past. If you want to look at the previous Zoom meeting, you can find it here as well. If you want to look at some of the already made slides, you can find them here to have an idea about some of the topics. We have a list of research projects. You can find them here, or if you go down, we will have them listed here. You can join any of these research project. Usually what we want is one of the fellows in a research project, let's say someone in this group. So we have a few fellows here. For example, if Saja is available and she has some time, she may be the leader or the project manager for this project. So she will be leading the team and dividing the task of what to do about this. Sometimes we have a file where we have some of the scrap or the skeleton of the project, what they need to do. And sometimes you can create it yourself if you know how to. If you don't, then maybe you can approach some of the other fellows, the senior fellows in the big WhatsApp group, so that you can have an idea of what steps or what task and how to divide the task between the fellows in the project here, project team. This is another way of doing the notification. What we want you actually to do is to go over the objective of this fellowship. We want you by the end of the year to hopefully finish all these topics or items. So we want you to know some of the principles of the research, the ethics, types, and methods, how to create an abstract and submit it to a conference, how to present in a conference, to make the poster, how to submit to a journal, how to revise your submission if the reviewer wants you to make any changes, how to change into a different journal if you have a rejection. So you need to see how you can find some other journal. If you are advanced, we want you to learn how to write grants and how to apply to get something like that, and how to build up a budget for your project and so on. So these are some of the the topics that by the end of the year, hopefully you have some ideas. Hopefully this will help you down the road when you go into residency, when you graduate, if you are interested in doing research, or if it's required during your training. So at least you will be ahead of your teammate in that program. I know some of you might have good experience with research. Some of you might have a little bit. So we divide you into early research experience where you have some, but you are not the expert. Late research experience where you have good experience and knowledge about the research from A to Z, and you already submitted and you published. And in between, we have those who have some knowledge, maybe some experience, but they didn't reach the level where they are we consider expert or advanced researchers. So in this group or in our program, we have all these levels of experience. So you can reach out if you are in the early research phase. If you have questions, contact any of the seniors or those who have some knowledge about the topic or the method or what to do. And anyone from this group, they can help you navigate or answer the question, or at least lead you to the right track. This is how we built our community here, and hopefully this will help you guys. The two main approach is the team approach, where you will have a team leader. It's just for organization method and to make it easier for communication if you have questions and for presentation during our meeting. And the other approach is the team for projects. So project teams that each one of the members in a team, they can work together and they can publish together. One more thing we used in the past is developing mobile applications. We were successful and published at least 5 mobile applications. Some of them were published in Google Play Store, and one of them was published in Apple Play Store. We have some teams who are working on different new apps for patients with renal disease and other group of patients. So in the WhatsApp group, if you are interested, you can approach the project in that leader in that area, and they can allow you to join the team, and hopefully you will learn. Any questions? Please jump or raise your hand and let me know.
Yes, Dr. Nader, I just sent a message. I had a present for the oral cancer I did before. If you don't mind, I can present it one more time, just in case if there is any of the new of the followers, I can do that.
Sounds good. Do you have your slides ready?
Yes, let me try. Maybe I can do that right now. It's the oral cancer.
Okay. So in the meantime, if there is anyone with any questions, please use the chat to put any of your questions, and go ahead when you are ready. You can present.
Okay, I can share my screen now.
Thank you.
You can see my screen. Is it clear?
Not yet. Yes.
Now it's clear? Okay. Okay, first of all, and my voice is clear also. You can hear me right now?
Yes.
Okay, so my name is Walaa. I'm a general practice dentist. I will present oral cancer. So the agenda first is definition, type of the oral cancer, incidence, risk factor, sign and symptoms, screening and early detect of the cancer, prevention and treatment. Okay, definition. Cancer is the uncontrolled growth of the abnormal cells in the body. The cancer develops when the body normal control mechanism is stop working. Oral cancer include the cancer of the mouth and the back of the throat. Oral cancer develop on the tongue, tissue lining, and the mouth and the gum area. It's including the whole area in the mouth. Type of the oral cancer. Okay. Type of the oral cancer. There is several type of the oral cancer. Squamous cell carcinoma, which is the most common. The second one is the verrucous carcinoma, and the minor salivary gland carcinoma, lymphoma, and mucosal melanoma. Squamous cell carcinoma, this is the most common. It's almost 90% of the oral cancer. Most common type of the oral cancer, more than 90% of the cancers that occur in the oral cavity are squamous cell carcinoma. Normally, the throat and the mouth are lined with squamous cell, which are flat and look like a fish scale and in the or under the microscope. The second type is the verrucous carcinoma. The verrucous carcinoma, it's a less common, about 5% of the all of the oral cavity tumor, very slow growing cancer made up of the squamous cell. This is type of the oral cancer. It's rarely spread to the other part of the body. So that's mean we can just treat it easily because we are just focusing on the specific area that affected with the cancer. But it may invade nearby the near tissue. The incidence. Overall, 11.5 adult per 100,000 will develop oral cancer. And oral cancer incidence rate are significantly high for male than female. The incidence rate of the all age is male nearly 3 times greater than the female. Oral cancer incidence rate are high in the white. So this is a comparison between the male and female and the white and Hispanic and the black. So it's oral cancer, it's high rate in the white male than the Hispanic and the black male. The incidence of the oral cancer increase with age. And increase become more rapid after age 50, particularly for adult age 65 years and older. There is a lot of risk factor. One of the risk factor, and it's most common, it's tobacco use. This is include smoking, cigarette, and pipes. This is and chewing tobacco. All of these can cause this oral cancer. Risk factor, human papillomavirus also, HPV, chronic facial sun exposure when exposure to the sun for a long time, previous diagnosis of the oral cancer, there is any family history of the oral or other type of the cancer, weak in immunity also, this is one of the most important risk factor, and poor nutrition and genetic syndrome. There is early and late signs and symptoms of the oral cancer. So present red or white patch in the oral cavity, Non-healing ulcer, there is any ulcer starting in the oral cavity and it persists for more than 1 week. In this case, we will ask the patient to go for the specialist to just screening and diagnose early. Progressive swelling or enlargement, unusual surface change, sudden tooth mobility without apparent causes, unusual oral bleeding or epistaxis, and prolonged for hoarseness, or the patient can lose his voice. And other symptoms is the late symptoms. It's, for example, is the dysesthesia of the tongue or lip. So there is persisting of numbing of any part of your mouth. You're feeling numb on your lip or feeling numb on your tongue without any cause. And the other thing is the chronic earache or otalgia, cervical lymphadenopathy, altered in the vision. Suddenly you cannot see properly, you can just see blurry. Airway obstruction, trismus dysphagia, persistent pain or referred pain, and weight loss. And how we can screen and diagnose that cancer. There is an early detection. If we need to detect early, we have to go for a very brief history and then go for physical examination and then go for biopsy. So if we take a brief history and then go for a physical examination, we will go for biopsy, we will just decrease the time for diagnosis and it helps a lot in the treatment of the cancer in the beginning. The clinician should review the social and medical history and should document the risk and behavior, tobacco and alcohol uses. History of head and neck radiotherapy, familiar history of the cancer, patient over 40 years should be considered at a high risk of the oral cancer. Inspect and palpate. During the examination, we have to do after inspection, we can just do a clinical exam by palpate the head, neck, oral, and pharyngeal region. Procedure involve digital palpation of the neck, any of the lymph node and the region area. By manual palpation of the floor of the mouth, we will start to palpate from the floor of the mouth, from the tongue, and inside and outside, inspection with palpation and observation of the oral and pharyngeal mucosa with adequate light source. If you find any abnormalities in this area, any palpation, any inspection, white lesion, red lesion, any scratch, any inhaled ulcer, in this case, we will ask for biopsy. So here there is the intraoral picture. This is the gingiva, lip, and this is just a buccal vestibule, and this is the gum area, and this is the palate, and this is the tonsil area. We have to do exam all of these sides. You have to just rub the tongue right and left and press the tongue in the floor of the mouth and bring some gauze. Sometimes there is a white lesion, but you can just wipe it with the gauze. It will go with the gauze. In this case, there is another different diagnosis, but if we cannot remove it, in this case, we can go for biopsy. Biopsy is the medical test that involves taking a small sample tissue from the affected area. It's very simple. We will take the biopsy sample from this affected area and then we will send it to the lab. So prevention, how we can prevent ourselves from that. Help prevent development of the oral cancer by healthy lifestyle, avoid tobacco use, limited alcohol intake, reduce exposure to ultraviolet light. Treatment of the oral cancer, it depends on cancer lesion and cancer stage, as well as overall health and personal preferences. You may have just one type of the treatment or you may undergo combination of the cancer treatment. There is surgery, there is radiation, and there is the chemotherapy, and there is the target drug therapy, and there is the immunotherapy. As I said before, it depends on the stage. If it's in the first stage, we can do only surgery. We don't need to do anything. If there is, it's spread to the other lesion, or the doctor decided to go for radiation, we can just do combination between these two. Surgery, it remove the tumor. Surgeon may cut away the tumor and margin of the health tissue that surrounded it to ensure that all of the cancer cells have been removed. A smaller cancer may be removed through minor surgery, and larger tumor may require more extensive procedure. Surgery to remove the cancer had spread to the neck. The cancer cell have spread to the lymph node in your neck, or there is a high risk that this has happened based on the size or the depth of the cancer. A surgeon may recommend it a procedure to remove lymph node also and related the tissue in the neck. Surgery to reconstruct the mouse. Surgeon may recommend it reconstructive surgery to rebuild mouse to help the region ability to talk and eat. A surgeon may transplant graft of the skin, muscles, or bone from other part of the body to reconstruct the mouse. Because there is some part of the mouse we cannot leave the patient without that part of the mouse because it's important to eat and talk and something like that. We can do just a reimplant from the other or transplant from the other or grafting from the other skin and muscles, or sometimes we are doing a plate or anything from outside just to reconstruct that area which it was affected with the cancer. And the radiation is one of the type of the treatment of the cancer. Radiation therapy use a high energy beam such as an X-ray and proton to kill the cancer cell. Radiation therapy is often used after surgery, but sometimes it may be used alone in early stage of the mouth cancer. In the other situation, radiation therapy may combined with the chemotherapy. This is combination increase the effectiveness of radiation therapy, but also increase the side effect. So if we do the radiation combination with the other one, it may increase the side effect, but sometimes we need it because the stage of the cancer is beyond that one of the treatment. We need a combination of the treatment. The chemotherapy is the treatment that use a chemical to kill the cancer cell. Chemotherapy drug can be given alone in combination with other chemotherapy drug or in combination with other cancer treatment. Also, the chemotherapy is the one of the treatment of the cancer. Also, we can give a chemotherapy alone or we can combination with the other. Also, it depends on the site and the stage of the oral cancer. There is the target drug therapy. A target drug therapy mouse cancer by altering a specific aspect of the cancer cell that fuel their growth. Targeted drug can be used alone or in combination with the chemotherapy or radiation therapy. This is one of the type of the oral cancer treatment. Immunotherapy treats are generally reserved for people with advanced oral cancer that's not responding to the standard treatment. This is the reference I just copied here, and I did my research from that. And that's it. Thank you so much. And I'm so sorry for this is a short presentation, but I wish I help. And if you have any question, anything, just feel free to ask.
Thank you so much, Dr. Walaa. And this is excellent presentation. Any questions or in addition to Dr. Walaa? So in our program, we have dental graduates as well as medical graduates. In the future, hopefully, we will have other disciplines, but for now. Hello? Yeah, okay.
Dr. Nader.
Go
Hi,
ahead.
how are you?
Oh, very good. Thanks. How are you today?
I'm fine, thank you. I have a question.
Yes.
A builder, like easy to work with, but my question is that like do you prefer using modular or using another app builder because Codular is only for Android. So, in your opinion, which is it? Do I use my time wisely learning about Codular, or do you prefer another app builder?
That's a great question. So it depends on what you want to reach out, like your patient's population. So I think in the past, Codula was a good option, but with the development of AI nowadays, I think it's more into AI generated. So you just give them the idea and then ask them with some prompts to modify the app for you. And most of the app nowadays, it's built like a web-based, unless it's game-like, where you want them to drag and drop and so on. An interactive kind of approach, then maybe you need some way to overcome that using either Codular or other coding approach. But if it's a simple action between the user and the app, nowadays you can create this using different app generators. It's a good question because I'm gonna show you how to do that using Canva. If you follow me, I'm gonna just create a simple app, and then maybe you can help me tweak it or modify it. So let's say I have a patient, and that can be used in your practice. That's okay. That's okay. I know you have to be. So, for example, I have a patient with hypertension. We want to monitor their blood pressure, and maybe we need to increase or decrease blood pressure medications. And they are not living with us here, but they are somewhere far away. So instead, just to write them down and then screenshot the paper and then send me, and then I tell them. I can just give them the app, and then in their phone they can just every day they do the blood pressure reading. They just put it, and then I can track that, and depending on what I see, I can advise them, for example. So there are different ways of doing it using the AI. You can use Gemini, for example. There are DeepSeek, for example, and other ones that I'm gonna show you. I'm gonna just share the screen, and then we can take it from there. Give me a second. I have to answer this question.
Okay.
Sorry about that. I'm gonna show you. So if you log into Canva, for example, the first time you log in, you can have these icons where you want to start a new document, a new presentation, and so on. But up there, you can see Canva AI. So with that, you can create a prompt where you can say, code for me. So here you will say, for example, I need a mobile application for patients with hypertension. So you identify what you want to track. I want to track their systolic blood pressure, diastolic blood pressure, and pulse, for example. Can you So here it will create a simple app that they use the code for it, and it's gonna just be a web-based app where the patient can enter their information. So it's gonna write the code for you, and it will show you the output in a minute. So if you don't like the colors, for example, you can say here, can you make it more colorful, for example? Or if the font or the text are very small, you can increase the font size, for example, if it make the app, but the text is very small. So this is gonna be built, and then you can ask the tool to modify it for you. If you like blue color, you can either say, I want you to focus on the colors to be blue or something like that, for example. You don't have to know coding, but if you want to, you can go back to the code and then modify anything that you think you can or you want to do that by yourself. But in any case, this is the output. So it's a blood pressure tracking app. You can log in using this, and then it will display the average systolic, diastolic, and pulse. And here how you want to add. So I don't like the blue. I want the green, for example. Then I will say, can you make it green in color, for example? So this is where I want to tweak, but let's see if it's working first. And if there are bugs or problems, then we can fix it as we go along. So now there is no reading. I can just add here. It will open a new window. I will say, for example, the systolic is 130, this is 90, and this is 70. And if there is any comments, for example, right arm sitting, I take that and save the readings. So here the reading will be, and next day the patient will say, oh, I have a high blood pressure, and it was 190 over 80. And this is, so it will give you an average of that, and it will give you the readings from previous day or the day to compare. So we have an app that's working for me, but I want it to be used by older adults, let's say more colorful and increase the size and so on. So it's gonna do the same. It's create the same app, and then it will make the changes that you ask it to do. So this is how you can tweak it and play around. If, for example, you want to get a graph, can you create a graph of the data for blood pressure and pulse? So it can create a graph. If you want to create a PDF file for sharing with, for example, if you want to create a PDF, they can print out or they can share it using email, for example. So they can have that list of readings saved as a PDF file, or if you want to have a graph so that you can see if the blood pressure is going up, increasing, or they have hypertension or something, then you can figure it out faster, for example. So this is how you can tweak. You give them the prompt, and then the AI will be working as far as coding, and then it will present you with the actual output. It will be a complete mobile application, and you can test that. I'm going to show you in a minute in your phone, for example, or tablet, or PC, or computer. Any questions so far?
Yes, Dr. Nader. Can I ask it to, like, can I bring another model, like another app, and ask it to do the same, and with some changes?
So now this is the changes that we found, and it's working the same way, and then the size of the font is increased. So now I'm gonna ask it to create a different app. So tell me what you want your app to be. Go ahead.
Okay, so it can be something with follow-up for investigations. For example, I want to follow like LFT, for example. Can it be something like that? Dr. Nader?
Yes, so let's say the
Yes.
app will track
Okay.
liver function test over time. Is that what you want?
Yes.
And let's say create a graph at the end every week, for example. Is that what you want, for example?
Yes. Yes.
So it's going to be the same method. So it's going to create what we call a database, where the user will add every day, for example, or wherever they get the test done, the results. And this result will be saved in a spreadsheet, and then it will be displayed the way you want. So in this prompt, I asked to create a graph, for example. It's going to build the app for you. And you can test it, either you add the information by yourself, or you can ask it to add mock data. So you can ask the AI to gather some information, just make it up, for example, to see how the app will look like when they create the graph and so on. Actually, I think it's already building some with some of the mock data, but let's see. And the output can be shared with the provider. For example, you can send it to a doctor via WhatsApp or email and so on. So you can also specify how you want to share the data with a medical provider, for example. So in the past, the dental group created this app where they wanted the user to enter if they did the flossing, if they did whatever, taking care of their teeth, and if they have denture, if they clean it, if they have, and if they need some educational videos, they added that. So that's also an app that can be developed using Canva. So you can ask it to create an app that is for people who are taking care of their, let's say, teeth or dentures, and flossing, and educational videos maybe for kids or for older adults, something like that. And it will bring some of the available video for you or educational material.
So, Dr. Nadia, can I add like other functionalities? For example, if a person has very high blood pressure, the app like gives him a notification that your blood pressure is very high, you have to go to the hospital now, or something like that. In case if I didn't like review his investigations.
Yeah, so we can modify that. For example, I can say add what's called alert. So this is the AST, LDL, for example, and so on.
Yes.
And the graph will be here, and the patient will add the information. So you can add an alert where if AST more than 300 or ALT more than 300, for example, show text saying contact your provider, for example.
Okay.
So alert, contact your doctor if ALT or AST greater than 300. So it's gonna rewrite the same code, but now it will add some parameters where the app will detect if the findings or the results abnormal to a certain degree. And it can be the same with blood pressure. For example, if the blood pressure is 200, the systolic, you can ask, can you repeat the reading? And if they repeat the measurement and the reading is still more than 200, then the alert will notify them to call the physician. Can you call your doctor? Or maybe you can take additional, whatever, half a tablet of lisinopril or something like that. So you can add all these alert or notifications in your app, depending on what you think is going to happen or you can expect.
Okay.
So it's neat that you can build it and then you can modify it as you go along. It's like a programmer for you. So you want to create the app, and then each time you want to add more features, then you come and ask using the prompt to modify it the way you want. The free version has a limit of 20 prompts. So you can communicate with the AI 20 times a day. So for me, I can modify this app or the previous one, but with 20 prompts. If I need to go more, either I can upgrade or I can use a different, let's say, account. But the same way I can do it using ChatGPT nowadays. It has a capability of doing the same coding and the product preview. Gemini, with Google Gemini, they can do the same. DeepSeek, it can do the same. There is a website, it's called Replit, and it's free, but it has also paid version where you can do the same, and it will build online right away for you, and it will host that app for you. So anyone with access to the internet, they can use that app. You don't have to upload it to Google Play Store or Apple Play Store. So anyone with a browser to the internet, they can use your app right away.
It's called Replit.
Replit. R-E-P-L-I-T. Replit.
Okay.
R-E-L-I-P-T. Sorry, REPLIT, replit.
Okay.
And you can use it for example, you can create games. What I did is I asked it to create a flash card game with Spanish word for me to learn. If I'm learning Spanish, I want to use common sentences or common words or verbs or something like that. Or I can make it clinically oriented, like for my patients. So I can create an app that teach me medical Spanish using the flashcard approach, for example. So it will list few words and then translation in English, and I can learn that, and I can connect it with AI. So every day it creates more new words for me. So every day I can learn something new in Spanish, for example. Any other questions or any ideas from other fellows? Anyone with patients, let's say?
Thank you, Dr. Nadir, for the great information. Like, I was totally lost. Like, during the last week, I spent the whole week learning about Codula, like 3 hours a day. I found it really like simple. I found a good material at the YouTube, but I think it's if I want to use my time wisely, it's better to use AI. Definitely.
Definitely, yeah. It's good when you want to use it for interactive, where you want the patient to, let's say, take this and move it to another site and something like that. With this AI, sometimes it may take a little bit more tweaking to do that, but with Codler, it's a programming way of doing it easier. But most of
I didn't understand like you I didn't understand
so
what sorry.
this now is more or less is a text-based approach. So it's only numbers, text, graph, and the user will only click and something happens. So it's very simple interaction between the user and the app. So the app will just ask for numbers here to add.
Okay.
And say yes. Okay, they want bilirubin. So here the alert. So the interaction is just you ask the user to put numbers, and then the app will analyze the numbers and will give them this kind of method or message where, hey, there is something wrong. Can you call your provider? Something like that. So it's only based on text and clicking or tapping from the user, if that makes sense. This is a simple approach to the app. If you want to make it a little bit interactive more, let's say I want to build an app where I want to compare two words like in a game. For example, here a key, and here door, and here a chair, and here let's say something I can put on a chair, a pillow. So I want to connect them. So I want to draw a line. In this app, I cannot do that. There is no way for me to, or to drag this with this.
Okay.
Cannot drag it. I cannot put a line. So there is limitation of the interaction between the user and the method that I'm using here. I want them to be able to drag things or manipulate the app in a way that it will create some interaction. So it's like a game. When you want to shoot something, you will drag here, the arrow will go this way. If you drag here, the arrow will move and go this way, something like that. So here, with this AI, I cannot do it. In Codelar, I can play around to make it happen. For example, I'm not saying it cannot be done. You can create it, but it may take a little bit of tweaking and longer to create something that with Codelar, it's kind of easier. But it depends on what you want to. If it's just only you want to display a video, they click on it, it will play, or interaction like what we have here, graph that can be resulted from data, then this way is better, it's faster, and you can create it, if that makes sense. The other thing is most of this will be based on the web. So if they don't have connection to the internet, the app will not work. But in Codelar, you can ask the app to be downloaded to the mobile, let's say the phone. And even if the phone is not connected to the internet, the app still can be.
Still work.
Mhm.
Okay. Thank you, Dr. Nadir. Thank you for providing that information.
Thank you. Anyone else with any questions or any comments, any suggestion, any ideas? I'm gonna close sharing. Anyone from the new fellows, any questions, anything unclear for you guys? So usually we have the topics, and then we have some like the clinical topics or educational material where we discuss about the medicine in general, similar to what Dr. Walaa mentioned about the dental or oral cancer. We focus on geriatric topics, but we can also touch on recent topics or something that is going on. For example, measles nowadays is a hot topic in the US, so we can talk about that. Then we talk about some of the skills that you can bring and share with others. For example, how you gain the skill of public speaking or presentation skill or leadership skills and so on. So this is another area. The third area, how to use tools like analyzing your data. For example, we can use Excel or Google Sheet for simple data analysis, or you can use SPSS or other specific tools that are used for data analysis, or maybe editing your material or manuscript, for example. Nowadays, you have AI available to edit. In the past, there are different tools that you can use, or reference management. So you can use different references in your paper when you are writing. So there's one called EndNote, for example, or other online tools as well. So we want to touch base on some of the skills or tools that can be of help to you guys when you are doing your research project. Or when you present in a conference, how you put a poster all together when you go in person to present that poster. Sometimes you can present that online. So how to do that, how to create a video along with your poster, for example, and so on. So this is the areas that we discussed during the meeting. And the last part usually in the meeting will be an update. So let's say some of you submitted an abstract to a conference. If they get accepted, then they will let us know so that we can move on to the next stage or phase. Or if they present it in a conference, they give us a feedback of what happened during these conferences and so on. When you attend in person in these conferences, it's very useful as far as making connections. You can meet with program directors or administrator or fellows or residents in these conferences, and you can learn, you can make connections and so on. So I encourage you, if you are able to attend some of these conferences in your area around your, if you are here in the state or maybe some other places, for example, in the Gulf, they have their conferences, and some of the fellows here attended these conferences, and it was very useful for them. So any updates from the fellows in this group today? I know some got accepted and poster was accepted in one of the conferences. I don't think the fellow is here today, but she sent me an email, and other fellows as well were successful in submitting their abstract. So congratulations to all those who got positive results. Any ideas or new suggestion for the program or improvement or things we can do together?
Dr. Nader, I have a question. We did a research on sleep apnea and finished that one. I'm looking right now where we can publish that one. Any ideas to help us? Because I tried to contact with the several journal, but unfortunately I did not get any acceptance or anything from that side. So how can I search for the journal to publish, or how can you help me to do that? Because the sleep apnea, it's ready now and everything is good, but I don't know how can do that.
I'm gonna ask you a few questions. Do you have that ready as a manuscript? You want to submit it to a journal, is that correct?
Yes, yes,
Have the abstract of that article, the
yes,
first, okay.
yes.
Did you use Jane Journal Finder?
No, Jane?
Jane, so I'm gonna show you if you go
Okay.
to, let's see. Okay. So if you type Jane Journal Finder, and it will give you journal author name estimator or something like that. Well, no. Which one? Yeah, this one. Jane biometrics.org. If you go here, it will have some possibility for you to just paste that abstract of the manuscript. You paste it here and click find a journal. And then if you, let's see if I can do it. Okay. I'm gonna just make a sleep apnea dementia. For example, if I can get any article or something, let's say we can get any of this. Okay, so let's say this is your abstract. It's different. Okay. So you copy your abstract and you put it here and click on find a journal. It will go and use your abstract as keywords and connect all these keywords and see what journals they accept most of your topic kind of related to that. So Journal of Sleep Research, this is one. The topic about dementia, so it touches on Alzheimer's disease. Sleep Medicine Reviews is another. Sleep, a journal, Neurology, Aging and Disease, wherever. So this is the list of journals that can match the abstract for you. And you go to the website for that journal, whichever you select, and it will give you a good idea about if they cover the topics related to this. And it has impact factor. So here you can see 1.1 influence or impact factor for some of these journals and so on. So this is a good tool where you can find which journal that can be matching your abstract. So if any of this is interest, usually I ask the fellows to select 2 or 3 and go to their website and see what in the past they accept similar topics. If they do, then you can go to the author page where they give you the guideline and make sure you meet all these guidelines as far as requirement and submit it, if that makes sense.
Yes, it makes sense. Thank you so much. I will try to do that.
Sure.
Thank you.
You're welcome. Excellent. Thanks for the question, and good luck with the apps with the submission. Thank you.
Thank you so much.
Some of the journal will cost some money, some will be reduced, and some will be free. So see which journal has good impact factor. And if you go to the fees section, you can look at what countries the author from, where they are either reduced or they are free to authors of these countries. For example, if your team of authors are some here in the US, some in, let's say, in Sudan, when you look at the fees, there is a section where they have either reduced or no fee for authors from these countries, and see if the Sudan is listed on the of the countries where the authors can submit with reduced fees or no fees. Then maybe one of the authors in your group will be the submitting authors, and that author will be from Sudan, for example, if that makes sense.
Yes, it makes sense. Okay, thank you.
Thank you. Any other questions or suggestions or updates or anything unclear? So I know next week will be Eid. Congratulations on Eid Mubarak to all of you. Hopefully we'll have good time. But if there are some of you are available to present, maybe you can approach the leader for the team leader on that day, Saturday. It's gonna be the second day of the Eid. If you are busy, that's we understand. And if you have some time to help or volunteer, please reach out, and you can put your name on the app or the WhatsApp group, and then hopefully we will have a good Zoom meeting next time and in the future as well. So if no more questions, I'd like to thank you all for attending today's meeting. And thank you, Dr. Walaa. Thank you, other fellows who contributed today. And I wish you all the best. You can reach me via email or text or call. I'll be happy to help as much as I can, and Dr. Ahmed as well. So we'll see you next week. Assalamu alaikum. Fi amantillah. Eid Mubarak. See ya.
Thank you, Dr. Nader, and Eid Mubarak in advance.
Thank you.
Thank you, Dr. Nader.
Thank you, Dr. Marwa. Good luck with the app.
Thank you. Thank you so much.